So we are talking about the gluteal muscles which take origin from the gluteal surface of the hip bone. There are three gluteal lines here: inferior, anterior, posterior. Between anterior and posterior, gluteus medius takes origin. Between anterior and inferior, minimus takes origin. Behind the posterior gluteal line, the gluteus maximus takes origin. It's a huge muscle. It has 7 more points of origin. This is just one. Okay, and that's how it covers all of them. It's one of the huge bulky muscle in the buttock area, which medically is called as the gluteal region. Okay, for the insertion, the gluteus minimus goes anterior to the greater trochanter, medius goes lateral to the greater trochanter, and on the posterior surface below the greater trochanter is gluteal tuberosity, where the gluteus maximus gets inserted. Only 25% of the fibers. Remaining 75% they go on the iliotibial tract. Action of the gluteus medius minimus is same, maximus is different, because these two are medial rotators, maximus is a lateral rotator. Now I'll talk about the action. Action of the gluteus medius and minimus depends upon whether opposite foot is on the ground or off the ground. When opposite foot is on the ground, this is gluteus medius and minimus together. When opposite foot is on the ground, this point acts as an insertion and there is abduction of the shoulder. Abduction of the shoulder, abduction of the hip joint. When opposite foot is off the ground, there is a tendency of the pelvis to sink, and that sinking is prevented by the opposite side gluteus medius and minimus by contracting. So यहाँ से वो ऐसे pull करते हैं so that this side doesn't sink. Two actions, medius and minimus. Opposite foot on the ground, abduction. Opposite foot off the ground prevents the side from sinking down. Gluteus maximus is a chief extensor. It is the muscle which goes literally like this from here and gets inserted here. It is the muscle which actually pushes our body and allows us to get up from the sitting position. By its reciprocal and relaxation, by its controlled relaxation, it allows us to sit down also. So that is another action. Okay. It is a chief extension of the hip joint, especially while getting up from sitting position, especially while climbing stairs, and also during running. But while climbing stairs, it is more active. Applied anatomy. If the gluteus medius and minimus are paralyzed, there is sinking of the pelvis to the opposite side. Suppose this side is paralyzed, the pelvis will sink. Okay, the foot is off the ground, so person will walk like this. This is the waddling gait. Okay, that test is called as Trendelenburg's test, where we see the pelvis is sinking when the foot is off the ground. In gluteus maximus, the applied anatomy is this muscle is so huge and bulky, so is used for giving injections in the outer and upper quadrant. Other quadrant, if you give injections, it can lead to paralysis. It can damage the nerves. Thank you.